Okay, terrific. I know people are joining. For some, it's their lunch hour. For others, it's still morning. But good morning, good afternoon. I'm Judy Klein, president of Unity Consortium. Welcome to Pandemic Parenting, Prioritizing Adolescent Health and Immunizations. So many of you know that adolescent well visits to healthcare providers dropped dramatically during the pandemic, with 4 in 10 parents reporting they missed a doctor's visit for their teen. Along with well visits, routine immunizations similarly dropped, and HPV vaccination in particular remains significantly below pre-pandemic levels. As for COVID vaccination, rates vary widely, with 10 states reporting that fewer than 50%, half of their adolescents, have gotten at least one dose, but of course, the remaining haven't gotten any. According to research with parents, the continuous debate with COVID-19 vaccines has caused even some vaccine-positive parents to question the safety of vaccines in general. Parents are overwhelmed by the volume, the tone of vaccine information, and misinformation they're hearing on the news, online, and in discussions with their family and friends. They're confused who to trust, whose advice to follow. So what's a parent to do? Where can they turn for vaccine credible information? And how can we restore vaccine confidence? The parents on this panel face these questions day in and day out. Together, let's air the challenges we face, talk about the importance of credible vaccine information, and explore ideas together for prioritizing adolescent health and immunization during the pandemic and beyond. Now it is my great pleasure to introduce our panelists. We have Risa Barron, founder and executive director of Health Information Project in Miami, Florida. Diane Eckert, mother of 2 teenage boys from Charleston, Illinois, and Unity Mom Advisor. LaWanda Lambert-Gurton, mother of 3 adolescents and young adults, a social worker in Indiana, and Unity Mom Advisor. And Derek Lewis, father of 3 and president of Derek Lewis Foundation based in Arkansas. We want to hear from you throughout the webinar today. Write your questions and comments in the Q&A area and be sure to be an active participant. Now it is my great honor and pleasure to introduce our moderator, Dr. Chelsea Clinton, Vice Chair of the Clinton Foundation. Thank you, Dr. Clinton, for leading this important discussion.
Oh, Judy, thank you so much for welcoming us so warmly. It is always just such a pleasure and privilege to be in conversation and in community with Unity. And as you, Judy, know, this is kind of such an important issue, not only to me, as someone who works in public health, but also very much to me as a parent. Similar to Derek, I am a parent of 3. And so I'm really grateful to everyone for being with us this afternoon, or perhaps this morning or this evening, depending on where we find you today. And just want to echo and underscore what Judy said. We very much hope that this will be a conversation. So please send us your questions, your thoughts, your ideas, your suggestions. We want to hear all of them, maybe particularly those that are most difficult for you, or that you may be kind of really grappling with, or that you see your friends or your family grappling with. So just an enormous amount of gratitude for kind of being with us today, and hopefully very much for being in conversation with us today. And since we are focused on parents, I hope that we can first really turn to the parents, who are part of this panel. And, Diane, maybe we'll start with you. And if you can just share from your perspective, as a parent, how has it been for your adolescents, like over COVID? Do they not want to go to the doctor any longer because maybe they're scared that's where people are who are sick? Do they think vaccines are more important or less important? Are they more or less, trustful of the healthcare providers in their life? Just what can you kind of share that you've observed, kind of your adolescence experience has been, kind of with regard to healthcare and their healthcare providers and kind of vaccines, vaccinations, over the last couple of years, and kind of where are they today?
Thank you. Thank you so much. And I just want to also thank the people from Unity who put this panel together. I think it's going to be really helpful to all of us. I have two teenage sons, and I've just been really impressed with the way that they've been able to talk about vaccination and vaccines. And I think through all of the difficulty and all of the grief that we've gone through this pandemic, one bright side has been that we've been able to talk more about vaccines, about the importance of healthcare. And so you'd asked about them being afraid to go to the doctor, and I do think that that was the case, especially early on when things were starting to shut down and we didn't know whether it was safe to go and sit in a waiting room at the doctor's office. And so we were lucky that neither of the boys were due for any of their major vaccines in the beginning part of the pandemic. So we didn't fall far behind, but they were nervous about going. They were nervous when it was time to go back and to go and sit in that waiting room with people who might be sick. And so I know that in my area also, people were waiting for advice from the schools, because that's where we usually would find out about what vaccines were due and when it was time to go back and have those preventative care meetings. But that wasn't coming because the children weren't going to school. And so it has been really interesting to see how my kids have been. They are very vaccine positive. They are very interested in making sure that they're getting their vaccines and their boosters, but the large majority of their friends are not. And that's been a source of some confusion for them, some pain for them. It's become a subject of knowing what to discuss and what not to discuss at school and so on. So it's been a really interesting time, I have to say.
Well, Dan, I hope we can return kind of to that thread a little bit later on in our discussion, kind of for what you've seen kind of your sons do, or how they've engaged kind of with their friends who may have questions, even fears around vaccines broadly. I do though want to kind of give Lawanda and Derek the chance to answer the same question though, around kind of what they each have observed, kind of their adolescents' reactions have been kind of to vaccines, vaccinations especially, and also just kind of their broader feelings around healthcare providers, doctors, nurses, over the last couple of years. Maybe Lawanda, we can start with you and then go to Derek.
Sure. Thank you so much. For me, I have a 19-year-old son at the time and 15, and my 19-year-old was getting ready to embark on college. So here he was needing to get some additional immunization shots that were required for entrance. And he was very fearful of that. He was not certain. The school was giving information out about the COVID vaccine as well. So he's trying to navigate this not only from a perspective of what's going to take place, what is this going to do to me? What's this going to do to my body, Mom? He was having to go into the room because now he's an adult for all intensive purposes and try to navigate that. And with my youngest son, the school was very proactive in providing information. But again, because he was home and he wasn't certain, a majority of his friends, just like Diane, they were not, their parents were not embarking up on vaccination, where our family was more proactive with that. So there were conversations that were taking place with their doctor, a lot of telehealth dialogues, and I'm fortunate that they had a pediatrician that we've been with for years. So he welcomed parents, even in venues such as this, to have dialogues about and ask questions about whether or not we were going to actually pursue vaccination. Their pediatrician is pro-vaccine, and so are we as a family. But of course, there were things that we weren't certain about because the pandemic just for us came out of nowhere. And so it was a challenging time. And there was a lot of fear and reservation because it was something new that we were embarking upon.
Thank you, Lawanda. Derek?
Good afternoon, everyone. Thank Unity and good hanging out with you again, Chelsea. First, let me say thank you to all the moms on this panel. And I say that to say that my wife is really the driver of the healthy home for us. And as we talk about preventative care and some of the immunization vaccinations going on with our children, her being the driver in terms of what we eat, what comes in the house, this whole holistic view of the home, it really stems from my wife. So I want to give her credit for that. I think what the pandemic did for us, our family we have healthcare providers in our family. So it was a little bit more easy to have these conversations because they're organic conversations in our household and our family as a whole. But I would say those conversations were a little bit more in depth. I too, at the beginning of the pandemic, had my son entered into college, and so getting him vaccinated probably was in the COVID sense was probably the genesis of these conversations, because I had to pull him to the side and say, "Hey, I need you to be an example of this for his two younger sisters." But they also, my daughters are in their routine because of their ages at 13 and 11 in their routine of certain immunization, tetanus shots and Tdap and meningitis and those types of vaccinations, HPV as well. So this was, I think COVID landed an opportunity to share more about those vaccinations and why, and really focus on the why. And again, my wife being the driver, we sort of all fall in line anyway, but it did land the opportunity to really talk about the why and give them the opportunity to ask their questions if they had it.
Thank you, Derek. Since, Lawanda, Derek, Dan, you all were talking about kind of where your children got information, whether from schools, from pediatricians. Derek appropriately, pointing out that a lot of their family information comes from care providers in their family as well as his wife. And I'll tell her you said that, Derek, if you ever need, validation. I wonder though, Risa, if we can turn to you and you could share kind of what you've observed for where adolescents, teenagers, especially are getting health information, both high quality health information that is rooted in science and evidence, as well as maybe less quality health information that is not rooted in science and evidence. I think your perspective would just be particularly useful here, given you started your work before COVID-19. So you have a real longitudinal look here. So what have you seen kind of for where teens and adolescents are getting health information? And then also if you could just share how that has shifted or not from your perspective over the last couple years of the pandemic.
Absolutely. Thank you, Dr. Clinton, for that question. So yes, we started our work before the pandemic. So we noticed that there was a void in the health education space. So first you have to start with the education before you even have that conversation about healthcare access. And the state of health education, as I'm sure most people can remember, is the PE coach teaching oftentimes from those outdated textbooks and the cheesy videos and the scare tactics. And a lot of states, like the state of Florida, where I'm residing, actually got rid of that model and just don't require health education at all for graduation. So as you can imagine, there's just an incredible void where we're not even providing health education, whether it's innovative or not. So our program, for example, is providing that science-based information, during the school day. So we're actually accessing all 9th graders in the school districts that we serve. So it's not an optional, after school activity. One thing that we absolutely notice is that children aren't getting health information, and definitely not accurate. And we know kids have access to a lot of misinformation, whether it's from their friends, it could be their best friend's older brother providing, what he thinks is health information, or what they can find online, Googling and finding less reliable information, or just social media. And a lot of the families, as you can imagine, don't have a relationship with an internist or a pediatrician. And even before the pandemic, they weren't necessarily going for yearly well visits. So they weren't even getting that science-based information from their providers, or don't have health professionals in their family. And a lot of families, especially those in immigrant populations, may not be familiar with how we deal with preventive health and those yearly checkups and the importance of that. And it's not just about COVID vaccine, about MMR and all the other vaccines we require to enter schools. And I think there's a lot of hesitancy just to access those providers and those immigrant populations because they're scared of immigration, Department of Homeland Security coming to their federally qualified health center, or deportation. So we think it's really important to not only provide students with health information, but provide a safe environment for them to have these conversations and to be able to talk about, this is what my parents say, or my guardians, what my grandparents say, what my church leaders say, this is what my doctors, it all gets very confusing. So, it's really just about providing information for them that's science-based, giving them a forum to talk about these questions that they have, whether it's science-based misinformation, coming from their family, their religion, and then helping them navigate. Kids are smart, so they really want to be part of the conversation. And I think it's really essential that we give them that platform to be part of the conversation, that it's not completely adult-driven.
Risa, I completely agree. I was reflecting while you were kind of starting your remarks about all of the health education that I had in the Little Rock Public School districts, in the 80s and 90s, from nifty nutrition, teaching me about like the food pyramid. Oh, Lawanda, I see you saying nifty nutrition, the food pyramid, to like a local dentist who came in to, teach us how to brush our teeth, to, yes, the PE teachers talking about fitness.
Right. You remember that This Is Your Brain on Drugs? I mean, that was our whole childhood.
Officer Moore, I remember the DARE officer who came into my 5th grade class. I remember the, Presidential Medal of Fitness, which I never won because I couldn't do a pull-up. And I'm still pretty bitter about it. But the reason I now am going through this catalog is just to illustrate how not that long ago, there was quite a lot of health information. And I remember in 7th grade, we had to take age appropriate, but reproductive and sexual health education. And that you also could go to the school nurse and get a condom or a tampon, or ask questions about why you might need a condom or a tampon. And it's just incredibly disheartening to me that in so many ways we've made so much progress since the 80s and 90s, and then in other ways we've lost so much ground. Absolutely. And yet we know that kids have as many questions as ever, especially now during a pandemic. And, I now, if we can go back, to our amazing slate of parents, because all of you talked about kind of where your children are getting information, or that maybe some of their friends parents are making different choices for them, as relates to vaccines and vaccinations. So I wonder if, Diane, we can start with you and then go again to LaWanda and Derek. Can you just share about kind of how your kids navigate sorting through what is good or not so good health information, how they maybe try to help their friends sort through what is good or not so good health information, particularly if, your children have friends who don't have the same access to kind of continual pediatric care, like what LaWanda was talking about, that her kids have had a long-standing relationship with their pediatrician. So just kind of, what do you see kind of as the information ecosystem your kids are living in, and how are your kids trying to help others navigate sorting through what they should trust and what they shouldn't trust at a fundamental level? Maybe Diane, we can start with you again and then go to you, LaWanda, if that's okay.
Sure. Thank you. I would say that I have had these amazing conversations with my kids, but it always leads to the same place. And I'll say, so where are you getting information from? And they'll say, well, social media, from the different social media that they're on is pretty much where they get all of
them. And Diane, is there like one social, are they like getting information mainly from TikTok or Instagram, or is it just sort of like all of it?
Twitter generally, but I do think that they are, it's more of a general, they'll go from one to the next throughout the day. It's interesting because neither of my kids really considers themselves a heavy user of social media, but yet that's where they get all their information from. So that's been just interesting for me as a parent to try to navigate and try to figure out where exactly this information is coming from and what they're hearing. And when they've talked about their friends, it's the same types of social media influence. And when I've talked with them about how they know if they're getting good information or not, both of my kids, they've heard me talk enough to be able to say, well, I know if it comes from the CDC or if I know it comes from the Pediatric Association, that those would be good sites. But a lot of their friends, the area that we live in is distrustful of government in general, I think. And so a lot of times when things will come from the CDC and they'll try to share it with their friends don't want to hear it because it comes from the CDC. So that can be really disheartening to me as a parent to know that those trusted sources and the ones that I've taught my kids to trust are not trusted by others in the community.
For me, this is a great question. This was an interesting dialogue that took place in my family. Of course, I like to consider myself the cool mom of the bunch of my children's friends, because I'm a social worker. There are a lot of things that I talk about, and they have a pretty good friend group, and their parents trust me. And so the dialogues ensued, you all. It was whether it was around the table and I was feeding them pizza, or whether they're just coming over to, they just want to have, hey, you're just going to make you eat some vegetables or some fruits. But these conversations were happening, and it was different because they were, for a first time, getting a lot of that information off of Facebook and TikTok and Twitter and Instagram. And some of it they were laughing about. It was kind of like making a joke, and they'd be like, Mom, look at this video. And then it gave me even a greater opportunity to kind of tear down some of those myths or things that were being said that I had done my research on. I had a better grasp of the information, but it was sparking in their mind questions. Even for my 19-year-old son, who's far away from grandkids, far away, y'all, he was like, what is this thing about? They're saying something about fertility and, and am I gonna wake up with one eye? I mean, it was all these random things out here in the social media that they were paying attention to. So it was definitely something that I said, hey, I need to get on these platforms as well as a parent. I need to see what they're listening to and what is being said to them. But it really was a good opportunity to kind of get even deeper into the dialogue about it. In addition to that, they wanted to know for the first time, like, what is Daddy thinking about this? Never has there been historically in our home a dialogue. I know it may sound strange where I'm having, particularly around the COVID vaccine, whether or not what was my husband thinking. Much like Derek, I'm the gatekeeper for all of this. Hey, get on schedule. We better not miss it. Let's go get a doctor's note.
Me too, Lawanda, in our house too.
Yes, right? I am that person, hear me roar. And so I was having actually a conversation with my husband about a vaccination for the first time in 20 something years, for us having children. And so they wanted to know. So now he's interjecting himself into the conversation. So the information was coming from multiple facets. But that social media, you all, it played a big part in the questions that they had about what they were hearing.
I mean, thankfully, though, they were asking them to you. And I think we'll kind of come back to that theme too, of how important it is that there are spaces, as Risa was saying, where kids feel comfortable, having dialogue with one another, and also hopefully with trusted adults. Derek, what was happening, for your kids?
Sure. And just let me echo one that that's why I started out with my statement, giving a shout out to my wife and you all, because you are the gatekeepers to this. I think from a misinformation standpoint, I think early on, I would get irritated personally with misinformation because it just seemed to be like, why would you think certain ways? But further we got in, I finally realized that not everybody has access to or not everybody is tuned in into these scientific evidence-based approaches to this. And then just depending on, you know, which news media you watch, it gets even more confusing and polarizing. And so again, we had to be very careful how information was coming into the house. But I will say that TikTok rules our household. It is my wife and my daughters, they have TikTok moments where they're just sort of doing their own thing. I'm not really included in that, but TikTok is provide the TikTok videos, as the one was saying, a lot of them were funny and mimicking some of the, I guess, the misinformation thoughts that were out there. And so that did provide an opportunity for us to go deeper into those conversations. But it also taught me to give folks some grace in this particularly in the COVID space. I mean, not only is there misinformation, you just didn't know the information was so evolving. And so we had to be careful with that. I think also as a parent, I had to start listening. And so like, my son is out to school, so I'm outnumbered with all the females in the house. And so their huddles, you know, just eavesdropping, ear hustling in their conversations, really about what their friends were saying and listening to them, how they responded. And it reaffirmed or confirmed some of the conversations we were having. And so I think just listening to our kids and being accessible and available to them, I think was very important as we talk about these issues. But I also think, again, going back to earlier statement I made, it made the other vaccinations and immunizations much more easy to discuss. I don't, in terms of, you know, like a HPV, like what is that? And so we got the opportunity to talk about that because COVID allowed that conversation to happen, and still talking about, well, here's sources that you want to be able to go to. TikTok can't answer that question, but you can go to your CDC or your state or local health department. What is the CDC, Dad? And so it allowed us to sort of again go deep into a lot of those conversations and where should they get that information from.
Derek, I certainly share your frustrations, and yet I have never been frustrated at people who are confused. Admittedly, I get frustrated at the organizations and the individuals who are actively perpetuating and often profiting off of the misinformation. That's admittedly where my frustration really sometimes more than bubbles over. Risa, I wonder if we can again, turn to you, since you do work with so many ninth graders and in schools, and I know actually you spend time with, adolescents really across the age spectrum. What have you found to be effective for kind of peer-to-peer education for kids who are really trying to help their friends navigate the morass of often, misinformation and disinformation, and as Derek, I think really has been helpful in highlighting not only around, the COVID-19 vaccines, but really around kind of vaccination and vaccines more broadly. What have you found to be effective, when kids are trying to be the trusted messengers to their friends, because maybe their friends, don't have the relationship, that Lawanda's, son's friends have with her, that Derek's daughters have with her, clearly, Diane's kids have with her. What can you share kind of what can kids do when kids really want to help educate their friends about why every vaccine matters, to their individual health and to our shared public health?
Absolutely. So, that's what we kind of stumbled upon 13 years ago when we were looking, for a program that we thought existed. And I think the vaccines are just part of a larger conversation of a lot of misinformation going on in general with kids. They're not getting necessarily accurate information about mental health, right? And that's not always a safe place, to get information, to talk about it, abuse, eating disorders, vaping and e-cigarettes. There's a whole myriad of health issues that I think the COVID conversation, because we didn't have that platform to begin with, we couldn't really tap into that, for COVID, because we weren't already having conversations unless you have HIP in your school about regular vaccinations. And as I mentioned, preventive health. So we see that the peer-to-peer model overwhelmingly works. Kids prefer, to hear from other kids. And this has been validated, in research over the years, and with our research in particular at the University of Pennsylvania, that they prefer to get their information from kids that look and sound like them. So what we do is we're taking that, information and that expertise of the CDC or of pediatricians and public health officials, and we're funneling it through these 11th and 12th graders who are going into these 9th grade classrooms, and these are their peers. And we know that whether or not kids are credible or not, in the eyes of teenagers, their friends are credible. Or the, girl that's on your volleyball team, or, the older kid who's the student class president, of the 11th grade, they look to these peers and they're trustworthy. So what we want to do is not have them funnel that information from Instagram and TikTok. We want to give them science-based information. So we always say we're using peer pressure for good. I think when you and I grew up, it was a lot more of, this is negative. All these terrible things are going to happen, and just say no to everything. We look at it as, let's, equip them with information. And as you mentioned earlier, we want them to go to the trusted adults. And a lot of them could be just at their schools. Unfortunately, the way that our schools look in this country, there are a lot of schools that don't have any nurses. You could have 3,000, 4,000, 5,000 high school students on a campus. And I can't tell you how often we interact with that school, and there is no health practitioner on the school's campus. The principal will tell you that, he or she is the first responder. So we need to have more nurses. We obviously need to have more mental health professionals. In an ideal world, it would be wonderful to have school-based clinics, because then we could fill that gap. We could provide the education, and then down the hall could be that trusted resource. So I think, using the peer-to-peer model is, just an easy way also of accessing more kids. We don't have to always be dependent upon the adult presenters who are very well-meaning, coming in from the community and doing a few presentations throughout the year. We've created this infrastructure where it's the students that are leading. And as you mentioned, they just want to step up. We give them the opportunity. They want to give back. They want to have these conversations, and they're really sponges when it comes to absorbing information and wanting to disseminate. And I think they're also dealing with a lot themselves. They're having these conversations at home. They're dealing with other physical and emotional health issues, and they want to help each other. And I think that's the really impressive part, is that kids want to help. They're very altruistic. They want to give back. They knew what it was like when they were a 9th grader. So it's really just so nice to see that, when kids are given the opportunity, they step up, and they're oftentimes going home and educating their families. And I think we can't discount that as well, that if we give them the science-based information, they go home and they start to tell their family, oh, I learned about diabetes, and maybe we shouldn't fry as much of our food that we love, or, explaining that, the childhood immunizations, we're already having those conversations. So 2 years ago, we just plugged in the conversations about the COVID vaccine into our conversations that we are already having through our program. So I think that if you provide that foundation, we can just kind of tap into that, peer-to-peer infrastructure.
Great. Thank you so much, Risa. I want to be respectful of the fact that we've had a few people submit questions. So I want to now turn to those and encourage, again, anyone who has joined us today, if you have questions, please share them with us so that we can get our panelists reactions and reflections on them. The first question, how do you respect your teen's autonomy if they don't want to get a certain vaccine, even though kind of you as a parent know that vaccination is the best prevention? I wonder, since we have started with Diane, maybe LaWanda, we can start with you if you have any thoughts in reaction to this question, and then we can turn to Derek and to Diane. But LaWanda, if you wouldn't mind going first. Sorry to put you on the spot.
No, thank you. It's a great question, because I was living that with my 19-year-old son. I was giving him the opportunity to make that decision for himself. And unfortunately, I do believe that his decision, although my husband and I were trying to give him as much information as possible, it came out of fear for him, because one of his friends in the close circle, mother passed away from COVID. And so he began to really, that was like hitting home. That was very close. And so we did respect our older children decision, hands down. We gave them as much information as we could, and we said, this is the moment this is the test where we've given them everything that we possibly can to make them successful. And we had to trust that they would make that decision. He lagged. He actually got it a little bit later than I would have wanted him to as a parent. And I think part of that, of course, like I said before, since he was getting ready to go into college, and they were, there was all these different parameters about what you had to do before. If you didn't have the vaccine, you had to do this, you had to do this, you had to do this. It was a whole bunch of more steps versus just drive up, get a test, and then go to your dorm room. So that played a factor into it as well. But we allowed him ultimately to make that decision, which as a parent was difficult because it wasn't anything I'd ever done before.
Diane?
We had a very similar experience. I think my older son and Lawanda's son are around the same age. So we also have a 19-year-old. And we had a similar experience where we had to say to him, okay, this is your choice. And very similar to Lawanda's situation, our son was taking classes at the university. Now he's living at home, but he did still have to either get the COVID vaccine or submit to regular testing. And we just pointed out all the things that he would have to do if he chose not to get the vaccine. He wasn't anti-vaccine, but he just is someone who makes decisions slowly. And so he sat on it for a while and did eventually decide, but it is hard. It is hard to realize that we're not even putting them in the driver's seat. They are in the driver's seat at a certain point and have to make those decisions. With our younger one, we also gave him autonomy in the sense of saying, we want you to do this, but we recognize that this could be scary or you might have questions. Because he is a minor, we felt a little bit that we could not impose our will, but that we could voice our opinions a little bit more strongly with him. At the same time, like Wanda said, we just really made a lot of time for questions, for concerns, for things they were hearing about, well, if I do this, then what might happen? And it was the same way we had already started those conversations back when it was time to get, for example, the Gardasil, the HPV vaccine, and their doctor was wonderful in terms of giving them a chance to ask questions and voice their concerns. So we were lucky that we'd already started that process earlier.
Derek?
I got to be careful here because the word autonomy, because our household, I don't know if we gave them a choice, honestly. I think what we did as a family, as two parents came together and said, this is what this household is going to do. But provide the why behind we're doing what we're doing. And here's why we took the approach. We did lose people during COVID. And so those losses gave us the opportunity to share in a different way. This is why we're going to do this. This is why this is important. And obviously they had questions, but this gives us the best chance, right? This gives us the best odds. We don't know all the information is evolving. And again, the healthcare background and sharing the safety of immunizations and what that process looks like. I got two little nerdies in the house. And so being able to tap into that allowed them to sort of, again, get a better grips on like the safety and the protocols into going into the vaccination was important. But the other thing too, so loss and then community. We're a family, we're a big family. So, getting togethers and vacations were very important. And so when the vaccination became available to our kids, we're planning a trip to Cabo, and if you don't get vaccinated, you ain't going, because we can't put ourselves at risk like that. But I don't know if we actually said, do you want to or don't you want to? I think we tried to present it in a way, at least me and my wife, with a united front. Or here's why we're going to do these things. So I'm not sure we strong-armed them to do it, but I do think we provided as this is what the family's going to do.
Yeah, thank you all so much. in the Q&A, someone is reminding all of us of Vaccine, which is an excellent website with a lot of kind of peer-to-peer educational resources of teenagers talking, with and to other teenagers about the importance of vaccines and vaccination, with not only all of those that Derek and others have mentioned, but really kind of every vaccine on the vaccine schedule. And so, thank you to the person who prompted me to remind all of us of vaccine. Risa, I want to turn to you because there are a couple of questions, for you. One is, someone just wondering how many states require, any type of health education today, and two, how many have the type of, peer-to-peer education that you're leading in the school districts you work with in Florida? And then I guess three, like, how hard is it to start those types of programs if someone who's joining us today were to want to start a program like what you're doing, in their local district?
So thank you for that. Your first question is an interesting one with an interesting answer. So I would probably say safely that every state has state health standards, right? And it could be in fourth grade, they're requiring something. But as I think the person who asked the question, made a really good point, there's oftentimes a set of standards, but who's implementing those standards, right? Who are the health professionals? What is their training? What is their continuing education? Is the state even making sure that it's implemented? So often we see, just with things in general beyond health, that there's a lot of mandates for schools and someone has to check off a box, but we don't really then look at it and say, oh, was that worthwhile? How many kids did we serve? What was the impact? Do we have the qualitative data? So yes, every state has state standards, and some form of health education, but a lot of them did get away from, like Florida, the semester of health class that we all had. Maybe we had that semester of PE and we had that semester of health class, and that was part of graduation. So you can imagine if principals are told you no longer need that for your students to graduate in your particular state, those resources will go towards math textbooks or an English teacher. So your second question, just remind me what was the next one?
The next question was sort of a set of questions around, how many places are you aware of that have the type of peer-to-peer education that you are engaged in, and also how easy or hard is it to start a program like what you help receive, kind of for anyone who might be compelled to
Absolutely.
to do something similar. Yeah.
Yes, thank you. So when we were looking 13 years ago of originally bringing, importing a program to Miami, because we always feel like, sometimes we're forgotten, or there's wonderful programs going on in New York or DC, Chicago, LA. There were a lot of programs that were very specific. So maybe it was teenage pregnancy prevention, bullying prevention, suicide prevention, but there wasn't a lot that was really dealing with comprehensive health. And we really feel like so many of these topics are intertwined. And just to mention, kind of piggyback on what Derek was saying, in order to have even the vaccine conversation, you have to talk about the anxiety and depression that kids are dealing with right now, right? And their anxiety about germs and COVID. And then you have to deal with the trauma and the grief that kids are dealing with because family members and friends passed away from COVID. So, so much of this is really intertwined. And unfortunately, 13 years ago, we didn't see any program that was comprehensive. So it was dealing with all of these health issues under one umbrella, but also was something that you could sustain at every school. As I mentioned, so many programs come in, they work after school, they work with a few classes here and there. What we created with Superintendent Alberto Carvalho, who is now, recently the superintendent in LA, was making sure that this was something that went through the school day, making sure that health was as important as world history or geometry. So, with, very enlightened school districts or leaders, we were able to do that. We're also in a bunch of other school districts in Florida, but we have plans to expand nationwide because we really see that there is an incredible void. And, I think sadly, the pandemic has made us realize that we need to provide a platform to have immunization conversations with kids and talk about preventive health. And we need to talk about mental health. And sadly, everyone is talking about it. But I think so much of it is we need to deal with prevention, not when the crisis occurs, and that's what we're dealing with right now. There is nothing short of, an emergency in the mental health world. So I think vaccines are just part of this larger conversation that we have to provide science-based information to as many kids as possible. And we just realized that during the school day is when you can access that many kids.
Yeah, thank you so much, Risa. And I also am going to be very just super presumptuous and say if anyone wants to know how to, start a similar, peer-to-peer program in their district, they should reach out to you.
Absolutely. We would appreciate that. Thank you for that shout out.
No, of course. I mean, you were talking about how you thought maybe something existed in New York or Indiana or Seattle or San Antonio. Like, I'm sure you really canvassed everywhere and then
Right.
you couldn't find a model. So you created one that clearly you have a lot of data that now validates the really like powerful effects of
Right. And I think you all, yeah, and I think you all recognize that sometimes people don't want to deal with teens, right? They're scary, their health issues are scary, or they want to have these conversations. And I think oftentimes we focus on that K-8 age group because they're less scary, but it's the teenagers that we really need to include in the conversations because these are also our future adults. So let's get to them early. So I appreciate you understanding the value of that peer-to-peer model. And definitely there's a void nationwide.
Absolutely. We also had a couple of questions around providers. One, pointing out how the rise of misinformation and disinformation, unfortunately, has also risen or kind of, precipitated a rise in mistrust for some people toward healthcare providers broadly. And so kind of one set of kind of questions around what more can we maybe as parents do to help kind of push back on that mistrust around providers? And then a second kind of set of questions around how can we help our healthcare providers start conversations around vaccines earlier so that you're not just having them kind of maybe at that specific well child visit, but that you're having them kind of earlier in an ongoing way, particularly as relates to HPV vaccinations. I wonder, Derek, just given all of your experience kind of working with and for and supporting providers, if this would be a set of questions you would feel comfortable kind of sharing your thoughts on, and then maybe LaWanda, you could also talk about as a social worker, kind of your perspective on these questions too.
Yeah. So working with providers, I would tell you many are just as frustrated as the parents and patients are as it relates to misinformation because it makes their job harder. And good providers want to provide good care and provide sound advice. I would say, and this is what my wife does really, really good when she takes our kids. She does this better than me because I get a list of questions that I didn't ask, but it's a conversation with the physician or with the provider about the particular subject, whether it's vaccinations, whether it's whatever the exam is, whether it's oral health. It's a conversation with the provider when the provider is providing the consultation at the end of the visit. I think it's very helpful, and it's a small community conversation that's going on within that visit. I think it's very helpful. I would say the second thing, if you can, and if you have access to providers, to have those one-on-one conversations where a provider can provide sort of their perspective, not necessarily that you're doing it at your exam, but at your local school, your church, your local community settings where you're having sort of town halls and conversations about these things. And I'll say this, being an African-American male, the vaccination was pretty scary for many African-American communities because of the distrust and the context of historical pains that related to certain things in the medical field. And so that was a barrier that had to be overcome. And so making sure the messaging is key, and making sure folks that in your communities that you're going to the grocery store with or church with, those providers have that, you have access to them so they can answer those questions for you, I think is very helpful.
Thank you, Derek. LaWanda?
Yes, for me, as it relates, of course, I've spoken very highly that the pediatrician, he was available, he was there. And it wasn't, again, just around the COVID vaccination. It's been that way strictly throughout. He would just, at one point, he's on Facebook Live, he's typing information in there and posting things so that those that will hear him, and he's a very influential in the African American community, specifically a pediatrician, and a lot of information. So he's had generations upon generations, children's, and so he was providing that information. But something that was very interesting, to Derek's point as well, was my husband is a pastor. And so while we traditionally think of folks, providers, we think of nurses and doctors and, licensed registered nurses and all that jazz. People begin to look even for in their faith communities to their pastors to provide them with this information. So there was a great call and a responsibility, particularly in the African American community, where those pastors had to then get in greater partnership with those medical professions to be able to provide the information that was needed. Now, Chelsea, from a perspective of being a social worker and a licensed clinical social worker at that, dealing with individuals who have severe mental health issues, it really became helping them to navigate what those questions that they wanted, what was their goal for their health and keeping themselves safe and their children safe. And so just that pure self-determination, helping them craft that and what that looked like so they would be prepared to ask those providers those questions.
Great. Thank you both so much. I think Lawanda and Derek, you also raise a really important kind of call for all of us that, we cannot expect our providers to do this alone. So while hopefully, every child has a school nurse, although we know that is not the reality for millions of children, and hopefully every child has a pediatrician, who as dedicated as Lawanda's is for her children. We know that also is not the reality for many children and families. And we do know that we all have a role to play in continuing to kind of be safe spaces and places for kids to ask questions around vaccines and vaccinations, and also to talk to kids about vaccines and vaccination, so that it isn't just all the pressure on that one well-child visit or that one kind of routine immunization or COVID-19 immunization campaign. We're almost out of time, but I want to be respectful of all the questions that we got and try to squeeze in two more, join together and ask for kind of each of the panelists' reactions, and then kind of whatever other closing thoughts they would want to share. We got a few questions around kind of just as parents, did any of you implement restrictions to your child's peer groups based on kind of different vaccination status? If so, how did you navigate that? And then also, how do you as parents talk to other parents who may be vaccine hesitant? So kind of now the parent question to complement the sort of adolescent peer-to-peer question that we had earlier. So I wonder if Diane, we can start with you again, and then we'll just sort of go through the panelists, and then kind of hand it back to Judy. But Diane and Lawanda and Derek and Risa. Diane.
I didn't have any particular restrictions for my kids based on vaccination, partly because in my area, it's a very rural area, their friend group is small, and most of the teenagers that I know, many of them are not vaccinated. So I didn't feel comfortable restricting who my children could be with, but at the same time, I did use that as a jumping off point about this is why we think it's important for you to keep wearing your mask, even though that mask restriction has been lifted at your school, and those kinds of conversations about just keeping everyone healthy regardless of their vaccine status. And in terms of, I'm sorry, what was the other question?
Like, how have you tried to talk to other parents who may be vaccine hesitant?
Mm-hmm. I think that when I would hear vaccine hesitancy or something that I thought may not be true, I think the same kinds of techniques that we use for other difficult conversations just come into play about asking a question, saying, that's interesting, can you tell me more? Or I wonder where you've heard that, or allowing people to voice their questions and concerns, because I think a lot of times the misinformation would build when people felt unheard and people felt that they couldn't get their point across, and then they would, the feelings of anxiety would grow. And so I think trying to have respectful conversations to be able to hear each other out has been important throughout this whole time.
Lawanda?
We did not, based on vaccination status, but there were no friends coming into the home at that point. We most definitely set up Zooms. We're like, hey, you can be with your friends over Zooms. We won't even be in there. Kind of let you all talk and play your video games and things like that. In addition to that, this is our youngest. She was 15. He didn't have a phone at the time. We got him a phone. We wanted him to stay in contact with his peers, but still being able to monitor that. But there were no friends, very few friends coming in. It was, later on. That was particularly because at that point, based on his age, he did not qualify for the vaccine. You all recall how that was staggered in. And so once he was, we then did allow some friends come over. Masks were most definitely required. And unfortunately, he is the greatest quarterback ever. I hope he'll see this one day. And he could not play those sports at that time because there was a high level of unvaccinated children. And so until that was able to be turned over, then we allowed him to participate in sports. And as far as talking to other parents, it was something that was done with quite ease. They are in a charter school, so it's a smaller community. And so we were able to have those dialogues with parents, particularly when they started saying, hey, everybody's going home, and we tried to go back to school, and then they said, everybody's got to go back home again. And so we were having those dialogues.
Great. Yeah, Derek?
I think early on, we had restrictions pre-vaccinations. Obviously, gatherings in the house, we were a big component of Zoom as well. And as folks, as our kids did get vaccinated, those restrictions were loose. I'm in Texas, so the mask thing, there's a rule of it, but we continue to ask our kids to wear their mask to school. And again, it's all around the safety piece. But I think early on we did have restrictions, and as things evolved, we loosened those restrictions. In terms of the parent, just because of the work I do, I think we were sought out to answer a lot of those questions. And again, I think I learned that I needed to provide not only the evidence base, but provide grace in these conversations, and not come from just I guess as a public health person in public health, but also talk as a parent though, and share what we did with our kids and why we did that with our kids. And I think those conversations were fruitful. Many of those conversations came back with parents who were reluctant to get vaccinated themselves, not less alone their children came back and shared that their family did get vaccinated. So we're very much involved in the parent conversations.
Risa, any final thoughts to share?
Yeah, I would just kind of comment on the fact that kids were struggling, when they were home in quarantine. They'd already been socially isolated from their actual physical schools, from extracurricular activities, social outlets, any mental health providers, or, just being with their peer groups, or even teachers having eyes on them. So I think when, you're dealing with some that are vaccinated, some that are not, some that have restrictions, maybe they live with a grandparent at home, right, who is, diabetic or elderly, or someone in the family that's immunocompromised or going through cancer treatment, those kids weren't able to mainstream as easily. So the social isolation just continues, right? And the anxiety and the depression. So I think so much of, the vaccination issue, continues for a lot of these kids, because people do have different levels of, kind of involvement in the outside world right now, based on the particular health issues in their families or their, beliefs. And I think we've just been trying to make sure that kids are respectful and understanding of other kids, right? And not adding to that, and making sure that kids feel as included and comfortable and safe as possible. But it hasn't been easy for kids, that's for sure, and they don't always have the coping mechanisms and those skills, to navigate this. We've seen adults have been having a hard time, dealing with their own peer groups with this conversation. So I think, the advice would be just to keep the doors open for kids to have these conversations, let them talk, let them know that you're there, and that's obviously for pediatricians, parents, any teachers, just listen and be there, because the kids are really suffering and they're not doing so well.
And there is no such thing as someone else's child at the most fundamental level. Well, I want to thank all of our panelists so much. I know we're a minute over, and want to just also thank Unity, and now hand it back to Judy to formally close us out today.
Thank you. And I will echo, thank you so much to the panelists for your insights and for the positive force you clearly are in your communities. Thank you for the participants for the excellent questions. And thank you for my Unity colleagues, of course, and Dr. Chelsea Clinton. Thank you so much for your partnership and your leadership with public health and immunizations in particular. Have a wonderful day and a wonderful Adolescent Immunization Action Week.